So like Dr. Melcher said, my name is Norma Guerrero, and I'm part of the Stanford Transplant Program. And we're really delighted to be here with all of you and to give you some information about our program and maybe answer some of your questions that you might have. There are some of you out there who are maybe thinking about transplant. So we're going to go ahead and give you some information. So I'm going to go ahead and just start off with a few slides. And here is the first, if some of you might not know, but the first kidney transplant was actually done in 1950. And it was between two siblings. Some historical events regarding Stanford's Medical Center, as you can see underground where we are now. And some of you also might not know that Norman Shumway was the pioneer of transplant, and he actually performed the first heart transplant at Stanford. Our current transplant program actually began in 1991. And also another fact is that we have a 1-year graft and patient survival rate that has always been higher than expected. That you can find on the scientific registry for transplant recipients and also in the brochures that we've handed out. If you look inside, there's also some information about our statistics, and you can also go online and compare us with everyone else out there. And so I'm going to talk to you about the transplant process for those of you who maybe are thinking about it, and sort of just go through some steps to let you know what's involved in the process. So generally when we get a referral to our program, some of you are on dialysis, and you guys see your specialist pretty often. And so some of them might have already talked to you about dialysis and transplant. And so at that time, you know, the decision is made if you choose to be referred to a transplant center, whether it's our center or any other transplant center. And so we go ahead and get the referral from your doctor. So just to cover some of the members of our transplant team, we have transplant nephrologists, transplant surgeons, transplant coordinators, social workers, financial coordinators, transplant pharmacists, patient care coordinators, dietitians, our staff at the histocompatibility lab, as well as a transplant psychiatrist. So like Dr. Melcher mentioned, there is quite you know, a lot of dedicated people who are wanting to, you know, have the best possible outcome for our patients. So there's a lot of teamwork that's involved. And so, like I mentioned before, we are the first contact in the transplant process. We also have another patient care coordinator who's sitting up here up front, Rochelle Stamper. So she wants to just stand up and give everybody a hello. So what happens with us is that we get your referral according to the alphabet. We split them according to the alphabet, and we have the breakdown up there. And what we do in the beginning is we give you a call and we talk to you about the transplant process. We get some basic information. It can be a very emotional stage when your physician has said, I'm going to go ahead and refer you for transplant. A lot of times there's a lot of information, a lot of questions you might have, and so our job really is to try to make you feel comfortable and to really give you as much educational information as we can in order to guide you through the process so that you feel more comfortable. We'll get some of your demographic information, your insurance information, dialysis, physician information, and then also at that time, you know, we'll answer any questions that you might have. If for any reason there's questions that we might not be able to answer, we will get you to the right person so that your questions are answered and we make you feel more comfortable. And also another part of our job is to you know, make sure that your insurance has coverage for the visit and for anything else that relates to transplant. We have wonderful financial coordinators who go ahead and work with your insurance companies to make sure that, you know, there isn't any issues with insurances, and to make sure that if there's anything that they need to talk to you guys about in advance, about any financial issues, then they'll go ahead and counsel you on that in advance. And what we do after that is we schedule the appointments. Now, the way we do the evaluations at Stanford is we schedule our patients for 2 appointments. The first appointment is a teaching session, which is a 2-hour presentation that our nurses give. And it's a slide presentation like we have here, but it goes into a little bit more detail about the waiting list, about the evaluation, about different topics that relate to transplant, and that really gives you sort of hands-on a little bit of information before you come to your eval. You have some knowledge, and our patients really, really like that because they're able to gain a lot of information, and they know, get to meet some of our staff, and then they also get to know what we have to offer at our program. So, like I said before, we are the first, for me and Rochelle, we are the first people who you will most likely talk to if you haven't gone through the process yet. And we try to put you at ease and try to make you feel as comfortable as possible, answer any questions. And also, part of our job is if you feel that transplant's not for you right at this time, we still take the time to give you the information, to walk you through, to answer your questions, and to just be available as a resource in the event that later on, once you decide, okay, I think transplant is for me, give us a call back. But we're always here, and our main goal is to give you as much information and as much resource as possible in order to help you make a good choice of what you decide to do with your care.